Hi everybody, and welcome to Leeds Dad's #AskADad Facebook Live with Ask a Mums this time as well. I'm Erroll Murray from Leeds Dads. We support dads and families to engage with their preschool children, and during these sessions we talk about life under coronavirus, what it is and how families can cope in the current situation. Our focus tonight is on childbirth and having a baby, and how dads can support the mother and child with the current coronavirus regulations that we're having to live with. Our focus with us tonight is Sarah Bennett, Leeds Midwifery Service, from Leeds Midwifery Service at Leeds Teaching Hospital Trust. Mark Williams, father's mental health campaigner, author and speaker. Claire Licence, the co-chair of Leeds Maternity Voices, and Ron Bertice, who's part of Leeds Dads as well. Can you all say hello, please?
Good evening.
Hello.
You okay?
Hi. Hello.
Great. All the technical problems are out the way now, so we can get straight into the thick of everything. Coronavirus, as many of you know, is a new flu-like virus spreading around the world. It causes an illness called COVID-19 and has been declared a pandemic by the World Health Organization. That's part of the United Nations that looks after the health and well-being of people around the world. What we know is that everyone who gets symptoms gets a fever, and a lot of these develop a cough. How we can prevent the virus? Well, at the moment, it's all about social distancing and washing your hands and staying at least 2 meters apart from other people. So tonight we're looking at childbirth, having your baby under the current conditions, and also about new dads, how they can support mother and child. If you have any questions, please get in touch. Message us on facebook.com/LeedsDads, or you can go on Twitter or Periscope and look for @LeedsDads, and we'll do our best to answer. First off, Sarah Bennett from Leeds Midwifery Service. Thanks very much for being on tonight. Just in the basic terms, what effect does coronavirus have on pregnant women and their babies?
Oh, well, thank you very much for inviting me, Errol. It's good to join you tonight. So most women don't seem to be seriously unwell. They seem to have the cold and flu-like symptoms that you've described. There's no evidence that pregnant women are more likely to develop serious complications than any other healthy individuals. But as you sort of said, and we know, this is a really new virus. It's only been with us a few months, so we don't know an awful lot about it. What I can say is that we are sharing the evidence and experience between countries and between places within countries, and we are updating our guidance on a very regular basis, receiving really regular updates, both from our Royal College of Obstetricians and Gynecologists in association with the Royal College of Midwives, and from Public Health England as well. So we're really trying to be as up to speed as we can be. But
these organisations, have they worked out what the vulnerabilities are for pregnant women? But what are the concerns specifically?
So most pregnant women are getting flu-like symptoms, in most cases they recover just like they would after a normal cold and flu. There is evidence that there has been transmission from mother to baby in one case throughout the world so far. But as I say, you know, we're working with very small numbers at the moment, and we will have more information as days go by.
So in the run up to sort of having a child, mums are pregnant women are attending antenatal classes. Should they still attend, and what sort of hygiene precautions are involved in those at the moment?
So absolutely, women should continue to attend their antenatal appointments if they are asymptomatic. if a woman or anyone in her household has the symptoms, and we're talking mostly about the temperature and the persistent cough, then they should stay at home 7 days if they have the symptoms themselves, or if somebody else in the household has the symptoms, for 14 days. During that time, they will naturally be concerned. They can get an awful lot of information from 111 online. They can call their midwife. And in Leeds, we also have a coronavirus advice line that is open during office type hours. So any questions that remain can be asked of a midwife there. And what we are doing,
could we get that number, please? Could we put that number out?
Yes, I haven't got it in front of me here, but certainly if anyone was to go on to Leeds maternity care website, it's on the homepage and it's in the leaflet that we've produced as well. But just to go back to appointments, because this is really important, that some of the early appointments in pregnancy that have traditionally been a face-to-face appointment with your community midwife, some of those appointments are now taking place by telephone, because we are wanting to protect women, we're wanting to protect our staff, and so we are social distancing and doing some of the things that are non-essential contacts. So a booking appointment, that first appointment with the midwife, is taking place over the telephone. And then the appointment around the 2 scan appointments are by telephone as well. And it's only from about 28 weeks of pregnancy that women will be having face-to-face appointments. But as I said, if unless a woman is symptomatic or someone in her household is, it's really important that she continues with her appointments. And she may receive a phone call from the midwife before the appointment is due, giving her guidance, asking her some screening questions, and maybe even asked to go to a different venue for her appointment, because we're doing fewer appointments, and because health buildings across Leeds are working in different ways, it may be that we ask a woman to go to a different place for her appointment.
We've had a message in from Lucy Hughes, who said, theoretically, if my partner has C19 symptoms, I assume he will not be able to be my birth partner. But will I be able to have another birth partner, or will the hospital isolate me even if I have no symptoms? A lot of things going on there, quite a few different situations going on there.
Yeah, absolutely. So we don't want somebody who has symptoms coming into the hospital. So unfortunately, in that situation, we would ask your partner to stay at home and continue to self-isolate, which will be very difficult for him, I'm sure. But certainly you would be able to have one other birth partner with you, as long as they were coming from a household that was asymptomatic, but only one birth partner. And we're trying to reduce the a practice that we don't want a swapping of birth partner during the birth either. We need to keep the hospital, our staff, and all our other mums and babies safe.
Okay, thanks. Claire Licence from Leeds Maternity Voices. Can you explain what Leeds Maternity Voices does first, please?
Yeah, so we're a group of volunteers, and we work in partnership with families and the Leeds Trust to improve maternity services within Leeds. So as you mentioned earlier, we've been co-producing the new COVID-19 guidelines that have just been brought out from the Trust. We're involved alongside Sarah, yes. Lucy, who was the co-chair recently, she's just left. She was co-producing that with Sarah. That was one of her final projects to do before she left. We have been in touch with the Trust pretty much from the beginning of the outbreak, getting updates and making sure that women are getting up-to-date information through the Facebook page, and also the Maternity Voice Partnership website too. So yeah, that's what we do.
And what are your thoughts on how the new maternity guidelines will work? The guidelines under COVID?
So obviously it's a lot different to what women and families are used to, but it's there to protect everybody, to protect the staff, to protect the women and the babies. And I think it's just, although it's very tough on people, I think it's kind of understanding that it's such unprecedented times, it's very unpredictable. The trust are doing everything that they can, and we just need to bear with them and work with them as much as possible.
Okay, so let's look at a real life scenario. The mum's due in hospital when the contractions are every 3 minutes. I'm trying to remember this as well. It's one every 3 minutes, and when mum's dilated by 5 centimeters. Is that right?
So if you're talking about sort of when a woman would be classed as in established labour, then the hospital would like to see sort of 3 contractions in 10 minutes. And dilatation, you can't really tell without going to the hospital and actually being examined. But if women, families are wanting to know the best time to go into hospital, I would say when you feel like you can't cope at home anymore, is the best time to go in. That would probably be real labour, you know, when you can't ignore the contractions any longer.
Okay, and if that's the situation, if the couple go in, say that there's a partner with the mum, and they find that it's too early, would the mother be kept, or would they both be asked to go home and stay at home until they're ready?
So I think Sarah probably better at this, but like normal, if a woman is in very early labour and there isn't a lot of progression, then usually they're offered the chance to go home anyway. So that isn't really within the norm. So if they went in thinking they're in labour and maybe they're not in established labour, then they will be offered the opportunity to go, should be offered the opportunity to go home and let things progress at home and come back maybe when things are getting a little bit further on.
Okay,
and I'm sure Sarah could clarify that. That's correct.
No, you're doing a great job, Claire. And I'm assuming in this scenario we're talking about a woman who's asymptomatic and who hasn't got any symptomatic members of her household, because we have, you know, we have to be really clear who we're talking about. So yeah, if that's the case, then just as normal.
Let's start with a normal case where there are no issues regarding coronavirus. Then the mum is due. She can't. How did you phrase it? She can't manage anymore, and she's ready.
Yeah, so contractions are getting unbearable. You're not able to. You find it hard to concentrate through them. You can't sit still. It's very different because labour is very, very different for every individual woman.
Sure.
So what is unbearable to one woman might not be unbearable to another. So it is very, very difficult to say exactly when that time is right.
Okay.
But I would say when that woman feels like she needs more support would be the best time to go in.
So she feels that she needs more support.
So maybe a little bit more pain relief, regular contractions.
They've gone in, and she's would she be taken? Say the baby's due. She's taken into the maternity suite or the delivery. Where would she go, and where would her partner be?
Sarah would.
Yeah. So again, sorry. Yeah, that's fine. So again, we'd encourage with the woman or her partner, if she's not able to, just make a phone call to the hospital to let them know that they're on the way. They'll be asked questions, screening questions around the coronavirus, and given instructions if they were to sort of indicate that they had any symptoms. But in this case, she hasn't. She'd be invited to come in through the maternity assessment centre as usual, and then taken through to the delivery suite if she is in established labour, along with her partner.
Okay, so they'll both go into the delivery suite.
That's right, yes.
And the baby's born. It's a straightforward birth. Mum and her birth partner are together in the ward. In the delivery suite, and then they're given a bed in a ward. What would happen next?
Okay, so in the current situation, given the coronavirus outbreak that we have, we are encouraging, if mum and baby are well and have got the support of a partner at home, that they can either go home directly from the delivery suite, or if mum does want to stay in overnight with the baby, unfortunately the partner is not able to go with her to the postnatal ward. So that's a real big change for mums and their partners. Previous to this, we had sort of open door for a partner who could stay 24 hours a day on our postnatal wards, and unfortunately we're not able to accommodate that during this coronavirus outbreak.
So dad will have to, or the partner would have to leave then, and mum would be unaccompanied in that respect. Do you have plans to support mums in this situation if they have English as a separate language, an additional language, or if they have learning difficulties or mental health needs?
I mean, if it is somebody with for example, with a learning disability that needs a reasonable, some reasonable adjustments, then we will endeavour to make whatever reasonable adjustments that we need to do. With regard to interpreting, we obviously are trying to reduce face-to-face interpreters because, during this time of social isolation and distancing, it's not good to have many people coming through our postnatal ward. So we would be using the telephone interpreting service, and we also have an interpreter on wheels, so it's where you can actually see the a bit like we're doing now, where you can talk but you can also see the interpreter as well. So if mum wanted to sort of feel she was actually talking to someone who spoke her own language and seeing somebody, we could use the interpreter on wheels.
Okay, all right. Now, sorry, did you want to say something, Ron?
No, I was just thinking, in terms of the complexities of this, it's pretty a huge change. Just listening to Sarah and Claire talk about this and the questions you're asking, Erroll, it's a real big issue, and I can see that there are other people raising questions as we speak, and I'm sure you'll come to that, Erroll, in due course. But yeah, it's a real big issue, the impact on pregnant mothers and having children. It's a massive change.
Okay.
Yeah.
So just coming back into it, Sarah. So that was the where everything is going as straightforward as possible. In a situation where there are complications, say there is a complication as the mother is brought in, would the partner be able to stay at that stage?
I suppose it depends on what you mean by complication. If the complication is that either of them, if mum is symptomatic of coronavirus and has been with dad, and he is asymptomatic, then yes, he can stay if they've been isolating together, then that will be absolutely fine. If mum is asymptomatic of the coronavirus but dad is symptomatic, we will not ask him to come to the hospital. We will ask mum to bring an alternative partner.
Okay, so they can bring someone else who doesn't have symptoms of the virus.
Yes, that would be okay. One other nominated person, but no swapping and changing.
Okay. Mark, you're very You're very aware of how dad specifically can feel around childbirth. I'm sure that they will have to understand and they will recognise the challenges in terms of coronavirus. We're being asked to stand 2 meters apart in the supermarket queue. We're asked not to go into the GP surgery unless invited into the GP surgery. So you realise that there are a lot of changes, but how do you think dads are feeling around this sort of situation?
Yeah, I think like everyone just said, it's uncertain times. Everyone's got to change different policies in place, and the pressures are out there. But going back to the virus, it's just most important is keeping mum and baby safe as well. So I think speaking to the dads recently in the last 2 or 3 weeks, especially even today, mental health is a big problem we get in. Dads obviously getting used to their anxiety are slightly higher now due to what's happening. But when it comes to I worked on a hospital ward myself. People's had to change in a space of 3 weeks, and everyone's doing the best they can. I think looking on the benefits of fathers, the dads when the baby is born, they're going to be at home. That oxytocin release, that bonding attachment. you know, where dads are normally working 2 weeks, you know, they're going to have a good 12, 13, 14 weeks home, you know. So it's about making the best out of unfortunately a bad situation. Like,
so you're saying it may be a challenge not being able to spend as much time or even to be present for the birth if someone has symptoms of coronavirus. However, on the other side, dads may be able to spend a lot more time with their partners and help them and build that bond with the baby.
Absolutely. And I think, like you said, you know, with emergency C-sections and, you know, and if dad, this is a totally new area now. It's a totally for everyone, really. But coming from the mental health side of it, my wife works in mental health. I've seen a big increase, obviously, my wife's phone calls. And it's about looking after dad in a different situation, whether it's online. You know, we know about antenatal classes online now. We've got Dad's Rock, we've got Dad's Matter. We've got a lot of good things like yourselves doing things online. And we just got to adapt. Like my own work, I've actually adapted now as well.
So going through childbirth with the conditions of coronavirus, how do you think that affects couples going forward?
What's that?
How do you think that affects couples going forward? That being separated at the birth, maybe the antenatal classes could be over the phone, or like this in a video situation. And then the baby's born, and all of a sudden they're separated again, but they may be brought together for a longer period. Going forward, how do you think that affects couples?
Like you said, it's each your own. You know, some dads are going to be affected more than others. I'm a very person-centered. I am. You know, finding out some dads I've spoken to recently are quite happy for whatever needs to be happening. You know, we've got to let the professionals take this, you know, this lead. But going back on the mental health, I worry about after all this happening. The mental health side, that's what I'm more concerned about after this virus. Even hearing about on TV today about mums talking about their own anxieties during pregnancy, and you know, that's a big concern. That's why I'm happy we're doing this tonight, because there's not much talk about parents around this virus.
What are anxieties like around childbirth in this current situation, do you think? Because people may have planned the birth, they may have a full idea as to how it's going to be, where it's going to be, and then there's a phone call and maybe it can't happen in the same way.
Exactly.
What are they
I mean,
like?
If I could just jump in a bit, I mean, in terms of what you're saying, in you know, the big changes that this has had on people. I mean, you know, couples have planned to have a baby, and within that, there is so much stuff going on, not only with the changes of the childbirth, and, you know, you take there's the plus side of being at home with your child, but then there's the issues of people losing jobs, not working, and all that huge impact. So I think there are multiple issues that are going to have, you know, which for many is going to have extreme pressures on new parents who have had, you know, who are having new babies for the first time, or for even those whose families are expanding and they're having a new baby within this situation. So it's not only having to adjust, you know, for new mums, having to adjust to all these different changes with, you know, the current circumstances of COVID-19, but also the economic impact as well, which is going to be very, very tough for many. In the best of times, having children without COVID-19 in the best of times is a huge change for everybody in terms of parents having children. But with the addition of COVID-19 and all what it brings, you know, it's more stressful. And I think in terms of Mark, and, you know, with the mental health aspect, there is a huge issue around that. And as time goes by, I think more and more mental health issues will come to light.
Mark, do you see those challenges that Ron's highlighting?
Yeah, definitely, not just on parents, but also in mental health in general. I think
in mental health specifically.
In general, yeah, you know, young children. Obviously, my background is from a youth work. You know, coming from Bridgend, unfortunately, there was a lot of young suicide years ago, so it was never a reason why I got into mental health. But Going back to the dads and parents, obviously, like Ron just said, the pressures of, that transition is hard enough for some parents, but then you've got the financial costs, and uncertainty, especially when it comes to a father, the old traditional dad where, go out to work and that work is not there. So, I got to see the positives as well, that a lot of these dads are going to be home, that skin to skin, that oxytocin bond attachment, where unfortunately, as we know, a lot of fathers don't get that either. So, I like to see a lot of positives as well as, be realistic. There is going to be trouble with mental health with dads and mums.
Welcome to Leeds Dads AskADad Coronavirus Facebook Live. I'm Erroll from Leeds Dads, and focus tonight is on childbirth, having your baby under the current conditions, and how new dads can support the mother and child. And with me tonight is Sarah Bennett from Leeds Midwifery Service, Mark Williams, Father's Mental Health Campaigner, author and speaker, Claire Licence, co-chair of Leeds Maternity Voices, and Ron Batiste from Leeds Dads. We've had quite a few questions come through. If you have any more, please get in touch on facebook.com/Leeds Dads, or go to Twitter or Periscope and look for @Leeds Dads, and we'll do our best to answer. A couple of questions coming in. Lucy says, sorry, is the maternity suite completely separate from anywhere else in the hospital where C19 patients are held? And how can we be confident we won't catch C19 when we come to the hospital to give birth? Sorry for all the questions, but at 38 weeks, I'm quite worried about catching it. Sarah?
Okay, so the current status is that we do have some patients with coronavirus in the hospitals in Leeds, and the delivery suite is in the same building as other wards in the hospital. So I think it's following the government advice, ensuring that when you enter the hospital, that you maintain distance from other people, that when you arrive to the area that you're going to, whether it's the antenatal clinic or the maternity assessment area, that you wash your hands. You may be greeted with staff wearing a face mask, gloves, and apron in the first instance, and you may see more protective equipment that staff are wearing as you journey through our service.
So there will be patients with coronavirus, but they're being kept in separate areas.
Absolutely, yes, we do. We do have patients in the hospital with coronavirus at the moment, but obviously they're being isolated, and they are the staff looking after them are wearing all the correct personal protective equipment, and obviously hygiene is absolutely paramount.
Ian says, my wife is 38 weeks pregnant. A lot of people due soon. And when we go to hospital for her to give birth, we will have to leave our 2-year-old at home with her grandparents. When we come home with the new baby, do we need to keep them away from their grandparents and isolate again? What do you think of this? Are you able to help with this, Claire?
Sarah might be better with this one around isolating with grandparents, if that's okay, Sarah.
Yeah. Well, I suppose if the grandparents are coming into the house if the grandparents are having to come into the house to look after the toddler, then they're in the house. And I think when mum and dad and baby go home, then that's the environment that they're going home to. I would imagine that would be the case rather than the toddler going into the grandparents' home. So I think it's just really important that you sort of maintain hygiene, and that if anyone has any symptoms, they get advice as soon as possible.
Okay, here's one I think that is for you, Claire. Leah says, is there anywhere in Leeds hospital my partner can stay while I'm being induced and after birth? We are having our baby in Leeds, but we're from Lincoln because of a heart condition.
I'm not sure, Sarah. Again,
Okay.
Sorry, there's probably about one again that's better for Sarah with the sort of the conditions around that at the moment as to whether there would be anywhere.
Erroll, what was this mum's to be's name?
Her name is Leah.
Okay, Leah. Obviously, you're coming to Leeds for a particular reason, because we're a tertiary centre, and I think it would be really prudent for you to get in contact with whoever is providing your care. We do have facilities for staff to stay, and we've got some hotels and all sorts of amazing offers going on within Leeds at the moment. And obviously Lincoln is a long way away, so I think it would be really good if you could contact whichever team is caring for you in Leeds, and we could see what we can do to help you with that on an individual basis.
But there isn't anywhere in the hospital itself, I guess.
No, we unfortunately we just don't have that sort of we're not a purpose-built hospital. We don't have that accommodation. 5 years time, hopefully with Leeds Children's and Maternity Hospital, we would be able to, but currently we don't have that, but it may be that we can help you to source it.
Okay, I'm going to preempt this question from Luke. He's saying, can a mum leave the delivery suite even if it's the middle of the night? Sorry, this is specific, I know. I'm guessing he doesn't mean sort of like halfway through, can we go and get some fish and chips? Because there'll be nowhere to get fish and chips. But I think he means straight after the birth, after the child's born. If it's like 2 a.m., 6 a.m.
Absolutely. And I think what we've got to think about here is, are you going to be driving them home? Are you tired? Would it be better for you to wait till the daylight, for the daylight to come? Do you just stay in the room on the delivery suite, have a doze, have some skin to skin with the baby? Last night was really, really cold. I mean, it was frosty on the car when I got up this morning. So got to think about the temperature in the middle of the night as well. But certainly we will facilitate as early discharge home for mums and babies that are well as we possibly can. But we want you to be safe, and we don't want any accidents in the dark and the cold going home.
And Laura asks, if the mother goes home straight from the delivery suite, when would testing like initial hearing tests, etc., first take place?
Okay, so it may be that the screening team would come if you were there during daylight hours. They're not there in the middle of the night, but our hearing screening testers would come onto the delivery suite and could facilitate your baby's hearing screening before you went home. If you do go home without that being done, I believe there is a little bit of a delay now to what our normal practice would be, because we haven't got those sort of community clinics and those it's not advisable to be bringing people back. So if you can wait for the screening team to come on in the morning and have it done before you go home, I'd recommend that you do so.
That's good. There's another question here from Luke. Has there been any impact on anaesthetists, if I can say that right, anaesthetists being less available due to C19? My wife was worried before C19 that she wouldn't have an epidural, but is this still possible now? So he's concerned that because of COVID, staff are going to be pulled onto other practices, onto other departments.
Absolutely, and throughout the hospital that is happening. People who are due to have outpatient appointments, those have been cancelled. In general, not in maternity, elective operations have been cancelled. So there's a lot of staff in the hospital that are working outside of their normal workplace, but not in maternity. So we're very lucky that we're very protected, and it's I'd like to say business as usual, but we are working as normal as we can in this very strange and uncertain time. So yes, there will be anaesthetists on the delivery suites in Leeds if you want an epidural.
That's good news. Claire, along with the many hats that you have, one of them is that you're a doula. Can you explain what that does and what you've been doing in that respect in Leeds?
Yeah, so a doula is, we're a professional birth supporter, a birth coach. So I usually work with families through pregnancy, help them navigate the maternity system, help them sort of educate themselves on birth, antenatal practices, help them write birth plans, and then I go in and support through labour and birth as well with practical and emotional support. And then I'm usually there for a few weeks afterwards too, after the baby's born, helping with feeding and just getting into life as a new parent.
So you've got a good perspective on this. How do you think mums would feel?
So I'm very anxious. I mean, my daughter's currently pregnant as well. Her baby's due in 14 weeks. So I know firsthand that it's an anxious time for women. I know once Boris Johnson announced that pregnant women were classed in the more high risk category, that, you know, it was straight away as the MVP co-chair, it was getting onto the trust to get as much information out there as possible as soon as possible for women, trying to put their minds at ease.
So what are the concerns and priorities that they put forward?
So a lot of them are ones that have been discussed this evening. So it's about going into hospital with symptoms of coronavirus, about birth partners. That's been a big lot has been around birth partners and women worried that they're not able to have birth partners at all. There's been a few concerns around sort of whether home births are still available, which the trusts are fully still supporting home births. That's still going ahead as normal. So yeah, it's just really been questions around that.
Hold on. So home births will go ahead as planned?
Yeah, as long as the staff are there to cover the home births. Yeah, they're still going ahead.
That's fantastic.
It's amazing.
Is this Leeds?
Leeds, quite a few trusts are cancelling home births from what I'm seeing online, from what are coming up on the other sort of home birth support groups. But Leeds are still keeping that home birth going, which is absolutely fantastic.
That's amazing. It's a very challenging time to do anything like this. Mark, we're hearing from Claire about mum's anxiety. What do you think dad's anxieties would be, and how can they be calmed?
Yeah, there's a lot of websites out there now. Obviously, the NHS got a lot of websites comes to mental health in general. So NHS, if you Google mental health, NHS helplines. Obviously, I've told about some organisations out there, like I'll give an example. For Dad's Community Online, there's Dad's AF, there's Dad's Network, which does a community for dads, just to stop that isolation, because as we know, when it comes to fatherhood, the first year of fatherhood is probably one of the most isolating times for fathers, with hardly any support groups out there at the moment. And it's about supporting dad as well as mum, because as we know, with dad's anxiety, depression can impact on mum's mental health. So we do need a more realistic approach when it comes to, because it does, as we know, has far better outcomes for that development of the child as well. So there is a lot of anxieties around fathers at the moment.
What are the stats, Mark? What are the stats in terms of anxiety, mental health around new dads?
Yeah, when it comes to the NCT report came out, 38% of dads are concerned about their mental health. That was 2015. Young fathers, which I'm passionate about, coming from the youth sector, 39% of dads were concerned about their mental health, and 34% of those fathers are not with their children anymore, which is sadly impacts, as we know. November did a report last year. Like I said, the first year of fatherhood, 1 in 5 British fathers were totally isolated from their friends, because the connections change, as we know, with fathers. Like my best mate, with his daughter could be a 6 or 7 year old, and I got a new baby, I should say. And then sadly, if the mum has post-depression, up to 50% dads will actually get depression looking after mum. Dads themselves have post-depression. It's trying to educate what post-depression is in fathers. 1 in 10, at least, we know is high on that, obviously, because there's no screening in place for fathers at the moment.
What do you think about that? How do you feel about that?
Well, I think when we think the biggest killer in men under 50, unfortunately, we know what it is. And we're not screening fathers. Yeah, suicide. I find it shocking still in 2020. Even the World Health Organization doesn't recommend screening fathers. There's 600,000 male suicide every year. So we've got to change the times. That's eventually going to come. We have changed NHS England policies with a long-term plan, where dads will get our support, but that's only if mum has post-depression. The work I do, a lot of time, the mum is phoning me and saying, Mark, I'm fine. my partner has got a history of depression, anxiety, or traumas. Now the transition, witnessing of trauma, as we know, is PTSD. So there's loads of factors why fathers actually get depression in the postnatal period as well, you know. So it's like my work has always been, if you support all parents, regardless of gender, same gender couples, I should say, everyone, it just has far better outcomes for that child's development, as we know in the first 1,001 critical days, as they say.
That's right. I guess that it's something that Leeds Dads has been working on as well. I can speak about it myself, but Ron, I wonder if you could express some of the concerns that the Dads group has had, and the sort of like the things that we've been able to do to address mental health in fathers.
Well, just listening to what Mark was saying, you know, about mental health and so forth, I couldn't help but think about the importance of, you know, because, you know, couples coming together, having a baby is a massive decision. You know, it just tells me a bit more about relationships and about couples being able to be open and honest with each other, be aware of how you're feeling, and there needs to be support services out there to support each person in terms of what's actually going on for them in that relationship, because having a baby is a massive change for both people, as it were. As Mark rightly pointed out, you know, networks change, all sorts of things change. And I just think it's important that, you know, that there is such a massive support network for mothers, but there's not much for fathers. And of course, the balance needs to change. And whilst there are a lot of fathers out there who may not be voicing or speaking about their needs of such, I know within our Leeds Dads group, you know, when fathers come there, there's a lot that they have to say in terms of wanting to be a part of their children's lives, wanting to be more involved. Fathers who perhaps, you know, want to learn, want to grow, but probably just need a bit more encouragement, a bit more support. And I think that's what Leeds Dads provides for fathers. But at the same point, I think, you know, other services around it, particularly at the time when dads become, you know, when men become fathers, it's really important for more services to be around to support dads in that massive change. Much for fathers, and of course, the balance needs to change.
I think Leeds, funny how Dr. Zoe Darwin in Leeds University, I was working with her last year, and so there's a lot of good stuff happening in Leeds as well. You know, it's the passion up there was incredible last year. It was really good. So it is changing. We are seeing a lot of change, but it's, you know, where I was 10 years ago campaigning, I'm glad I'm in this situation now, if that makes sense. You know, we are seeing a bigger change now with services, and you know, and the more realistic, and like Ron said, it's the impact it has on your family. And the big thing, if anyone, any parents are watching it, is birth trauma is a big thing as well, especially around this time. You know, PTSD, because people say, we know it's an anxiety, post-traumatic stress disorder, but it's actually an anxiety disorder, either witnessing or experiencing a life-threatening event. So, you know, if you are feeling any, you may not get symptoms of nightmares or flashbacks, you may get symptoms of anxiety, please just speak to your professional, help as a midwife, anyone, make sure you get the support and help.
We're talking about mental health with fathers. This is something that you've been able to talk to me about, Claire, and sort of, you know, part of my work is regarding mental health and surrounding mothers and the birth of their children. But this is something that I think you were telling me a little bit about before, Claire, in terms of the dad's side, the partner's side of things.
Yeah, so it is more widely recognised now that dads do get postnatal depression. I mean, I know we've discussed it before, Erroll, that it was something my husband suffered with. So I have personal experience of going through male postnatal depression. And at the time with him, it wasn't recognised. It wasn't, you know, we didn't know what was happening. So it is a lot better now. The service is a lot better. It is recognised that men struggle with their mental health as well. And the best advice I give here is to talk to each other as a couple. Talk to each other. If you've got worries and and anxious feelings, you've probably both got those same feelings and those same worries and anxious thoughts. So discussing them just sometimes just takes half that load off, just chatting it through with each other, so you know where you both stand, you're both on the same page with things. I think that would be my biggest advice I could give on that, and that's through personal experience, and that's just to talk to each other as well. It's important to talk to professionals, but to talk to each other as a couple too.
That's really good. Thanks very much for sharing that.
Just wanted to jump in, sorry, Erroll, with Claire, what she said about talking to each other. I mean, Claire, you mentioned that a lot of the work you do is sort of like working with couples during the pregnancy and then after the birth and so forth. And I think in normal circumstances, pre-COVID-19, I suppose you know, I'm just guessing that when you're working with couples, you can give that face-to-face advice. You can observe and see and drop a bit of advice here and there, which may encourage couples to talk to each other and so forth. But
absolutely,
we're now in a situation where that can't be done, or it's very, very limited. Is there sort of like things, you know, going through, you know, couples going through pregnancy where there is video calling, you know, where that can be done and where advice can be given, and where, because looking at couples as well, they need a lot of support with that transition. Some couples need a lot of support with that transition,
absolutely,
in being able to talk about it and so forth. So I'm just wondering, are there any sort of services out there where there could be the video time for each couple, for couples during pregnancy, you know, short of counseling or anything? Because couples, not every couple needs counseling in that situation, but just maybe where there's a service where they could talk to, or if that's within sort of your kind of remit.
So as a doula, I do work with couples, and I have been sort of working with couples through this outbreak, and sort of helping them navigate birth plans and the care, giving antenatal, you know, sort of support there. So doulas are still available. Doulas are still out there.
Have a key.
Oh, I lost you.
Oh, that's Sarah.
Oh, that's Sarah.
Oh,
hello. I've returned. I've returned. I'm really sorry. What did I miss? I had someone locked out the door.
We found the cure for coronavirus.
Oh, jolly good.
No, we're just sorry. Continue, please.
Yeah. So I mean, couples can still contact doulas through this time. You can always talk to your midwife as couple as well, as with a couple as well. You know, your midwife, even if they're doing telephone appointments, you can still do that as a couple. You can still sit together as a couple and talk to the midwife together. So again, that would be a good recommendation. You know, still attend those appointments, even though you're not going to the actual, maybe not going to the hospital or the doctors, you're talking to the midwife over the phone. It's still a good chance to talk through any worries you've got then as well with the midwife. And health visitors, again, if they're calling in between 34 to 36 weeks, you get a telephone appointment. That's a good opportunity to discuss any sort of concerns you've got there.
Yes, yeah.
I think
absolutely.
so. And I think, you know, writing lists, sitting together and writing, you know, what your questions are for the midwife. You know, partners at the moment are not able to attend the appointment with a woman, but the woman can still ask the questions that the partner wants, you know, to be answered. Maybe keep a diary, right? You know, write things down. It's about planning and doing things slightly differently at the moment.
I think
but as Claire said, the telephone is a great way of being able to talk to your midwife for those phone calls.
Absolutely. And if you're having feelings of like, just talk about those feelings, you know, don't suppress them. You know, it's so common, you know, especially in fathers, it does look different PND as well, postnatal depression as well. So if people avoiding situations, drinking, anger, it can come out, which is it can. It's all different for every father. But if you're having those feelings, just talk to somebody, because, you know, it's very it's different to what it was a couple of years ago. The stigma is still there, but not far as much. We've gone a lot further in the last couple of years, definitely.
Welcome to Leeds Dads Facebook Live, AskADad. I'm Erroll Murray from Leeds Dads, and our focus tonight is on childbirth, having your baby under the current conditions. And with me tonight is Sarah Bennett from Leeds Midwifery Service, Mark Williams, Father's Mental Health Campaigner, Claire Licence, the co-chair of Leeds Maternity Voices, and Ron Batiste from Leeds Dads. If you have any more questions to put to us, we're at facebook.com/Leeds Dads, or on Twitter or Periscope, where we're broadcasting as well. You can find us under @Leeds Dads, and we'll put it to our team. They'll do their best to answer. Laura has said that there's some excellent information on the Leeds maternity groups about what to expect when going into Leeds hospitals when giving birth. I'd be grateful if a question could be asked, however, about the post-birth support available. I've seen various comments about health visitor appointments post-birth taking place by telephone as opposed to visiting the home. Will they all take place by phone? And if so, will things like weight, cord healing, etc. still be checked? I'll put that to both of you. Who'd like to go first?
Well, shall I start with the sort of the going home from hospital? So the general sort of practice has been that the day after you go home from hospital with your baby, you will have a visit from the midwife. What we're currently doing is sort of doing a telephone triage to see if that visit is still necessary, and if it's still necessary, a midwife will come and visit mum and baby and partner in the home environment. However, if it's not necessary, then it will be a telephone discussion. The visit on day 5, which is the day that we generally weigh the baby after the birth weight and undertake the blood spot screening test, is still taking place as a face-to-face appointment. So that might be in the home, or if it's at the weekend, an invitation to a specific postnatal clinic. And after that, the care will be personalised according to the need of the family, the mum and the baby, and some of it might continue to be telephone contacts because we are trying to minimise the contacts as much as possible. But if a home visit or another visit to the clinic is required, then that can happen as well.
Claire?
Hi.
In terms of after the baby's born, visits from midwives, visits from health visitors, and groups as well. What support is available?
So on the Leeds Maternity Voice Partnership page, we're sharing regular sort of updated information on sort of breastfeeding support groups that are available. Some are still offering peer support online. So we're keeping the page regularly updated with the postnatal support that is available for women after they've had the baby. Again, I'm sure Sarah agree, if you've got any major concerns, you'd be able to contact your midwife straight away, ring the maternity assessment unit, and somebody would be able to speak to you straight away if there's any major concerns.
How about the sort of that sort of net that's available, Sarah, that's the support that comes in for, say, even for the partners, for dads, there's a midwife, or is it 0 to 19, I think is the correct term now, for the health visitors who will come and check on the mum and the dad. And the idea of just being able to keep an eye on the dad as well. How's the dad doing? Is he coping well? Mum might be so tied up in the baby that she might not be able to see the nuances, the different changes. How can the dads be kept an eye on?
Absolutely, and you know, we are having to do more and more of it, as I said, by telephone. But you know, there's nothing stopping the health professional speaking to dad, you know, getting dad on the telephone. He can be in another room, he can say, you know, hopefully it might even be easier to do it when you haven't got the person in the room with you to actually talk about how you're feeling, and that might be easier over the telephone. So absolutely, there's lots of opportunities where we can try and encourage dad to talk, even though it might not be in a face-to-face environment.
In the same situation, reflecting at mums, when the issue is domestic violence, you may want to speak to the mum separately from the dad, but if it's all happening over the phone, it may be very difficult to be able to ascertain what the situation is at home. How do you think you can manage that?
Yes, and absolutely. In the early appointments, they are telephone appointments. In pregnancy, the early pregnancy appointments are telephone appointments. So asking those questions when you don't know whether the phone is on speaker is going to be very tricky. But as the pregnancy progresses, there's more opportunities to speak to mum on a one-to-one basis and to revisit some of the things that you might not have been able to ask, or just sort of pick up on some of those nuances or something that mum says, and just investigate further. And as I said, if we do have concerns about a family, we can still visit after the baby is born. We're just doing far fewer now than we were doing a few months ago.
Okay. So say the baby's born, the birth has gone well, parents are both home, both are exhausted, and but the baby's doing well, and one of them in the home contracts coronavirus. What are the key issues there?
The key issues are that they socially isolate themselves, that they stay at home as a family, that everyone in the household stays at home. They report their symptoms, so they can use the 111, they can contact their community midwife, their primary care facility, and they follow up on those symptoms. If symptoms seem to be getting worse rather than better, that they repeatedly inform people of those symptoms moving forward.
Would the baby be tested for the virus as well?
We are currently not routinely testing babies, even if mum has been positive. We're not routinely testing babies because a member of the family has been showing symptoms. Currently, as it stands today, and the situation does change a lot at the moment, but currently we're only testing babies who are symptomatic themselves. Okay, so if a baby had developed a cough or a temperature, then that the baby would be tested.
Is there anything that could actually be done, or would it be left to be treated as like a flu and to work its way through?
I think it would depend on the symptoms, and I think you'd need a paediatrician to answer that question. Luckily, there have not been, as far as I'm aware, throughout the world, there have not been many cases of babies being symptomatic, and I haven't read any information about that. So that would need to go to a paediatrician, neonatologist, or a paediatrician.
I see. And what about breastfeeding? Would the mum, if she has coronavirus, would she be allowed to breastfeed?
Absolutely,
Yes,
she would be encouraged to breastfeed. Sorry, Sarah.
No, it's fine. We said the same thing. That's absolutely fine.
Yeah, she would be encouraged to breastfeed because the baby gets its first immune system from the mum. So if the mum continues to breastfeed, she's getting the antibodies for the coronavirus from mum's breast milk. So yeah, they would be encouraged to continue.
And so is there any issue regarding passing the antibodies, the coronavirus, from mother to the baby? Because it's like the two issues there. That you're passing on the immunity. You're creating the immunity of the child through breast milk, but at the same time, you could be passing something on.
Absolutely, and we'd want mum to not socially distance, although putting the baby down more often might be a good idea. We might provide mum with a mask, and obviously ensure that she's being really scrupulous with her hand hygiene. If she's sneezing or coughing, she's doing that away from the baby.
Okay. Mark, the baby's home. Dad is now preparing to be a hands-on dad. How do you become a dad? How do you prepare to be a dad once the baby's home? What do you do? How do you do? It's not just about packing the bag. It's not just about having everything ready, or knowing that there's, or is it about having food in the house? Is it about listening to your partner? What do you think your top three things?
I think I just want to show you really quickly. There's a doctor just put a blog on today, actually. Dr. Ranja Das. So she's got a blog out about, and it's from the Department of the University of Surrey, and it's about new fatherhood around the virus. I can't really see it for you, but I can send you the link.
Okay.
And it's really interesting what she said, because it was a big push about maternal mental health yesterday. A friend of mine, Eve, did a lot. I think it was on BBC 5 today. So there was the lady, the doctor actually put something out for dads as well. What support groups out there. But going back to the baby development, is a big thing we do. Is grow brain. I don't know, grow brain, baby development. So depending on where area you're in, just basically engaging with the baby. Is some good videos, still face experiment with dads and mums. Obviously, you can see how just engaging with the baby early years, how important that is for child's development. But simple things, just I think making it more simple is just think. I think dads are going to be more at home now. It's not back in work in 2 weeks for the next couple of.
That's the point.
There's got to be benefits, I think, as well. After such a negative time, so if you are a dad out there, just use it to your best abilities. Because I think when I was lucky, I was home for 6 months because my wife was unwell with trauma PND, and I knew my bond attachment regrew in that 6 months. I was home, so it is benefits from actually being home as a stay-at-home dad during this time as well. But if going back to the same questions, if you are suffering from any sort of anxiety or depression as a dad, and you're worried about uncertainty, there is a lot of support online now as well. The NHS helplines, mental health helplines are doing some good work, and there's Dad's Pad. There's a lot of good community out there. If you're up in Scotland, I know we talk with Leeds, Father's Network Scotland. There's Leeds Dads. There's a lot of good things happening around us as well.
So what would your top 3 points be for a new dad?
For a new dad, education. Educate yourself online. There's loads of stuff online. Best Beginnings. Got a good website. Yes. A good resource on there. I would say if you are as a new dad, use like coping skills like mindfulness. Walking as we can. If you can take the baby. I see the mum this morning taking the baby out in fresh air. Obviously, that 2 meters away. And I think that's 2, isn't it?
That's 2.
I can think of a third for you, Mark. Yeah. I can pull you out here. And this was something I heard today at work for dads. Another thing that you've got to do is you've got to prepare and take food in with you, because when you go onto the delivery suite for the labour and the birth, you're not going to be allowed to pop out and pop back in and out. And
really?
Out. And you're not going to be able to order a takeaway, because we're reducing the number of people coming, and that includes delivery drivers to the hospital as well. So my top tip would be make sure you've got all those foodie snacks that you need for whatever the duration is, and the duration, it might be a long
24 hours. Yes, it could be longer. Does that mean they could bring in food that can be heated up as well?
Oh, I'm not sure about that. I'll find the answer to that question. You can post it on. We'll post it. Yes.
We'll post it here.
I'm not sure.
As we'll post the link that Mark, you were telling us about as well.
Absolutely, and I've got the phone number for you for the coronavirus advice line as well, Erroll. I'll send that to you.
We could share the video on the Leeds Dad's Facebook page after this, which has got the little video that the trust made with the phone number and everything on. So
that's really helpful. In terms of the issues you were talking about earlier, Ron, Alex says check out Andy's Man Club. They literally save lives. Hashtag it's okay to talk.
Yeah, brilliant.
Okay, you're aware of them, Ron, obviously.
Yes, yeah.
Okay. We're
they're actually doing it online now as well.
Yes, the groups they have hundreds of men who come together across the country in different groups, and because of the current situation, they haven't been able to meet physically, but they are meeting virtually, which is amazing and really quick that they've got together so quickly. So, hats off to Andy's Men's Club for being able to put together a network of groups where they can come together and talk about the issues that involving anxiety, depression that that haunt so many men. So it's definitely worthwhile. Lots of thank yous and lots of people mentioning that they're listening. Michael, Alex, Luke, Jennifer, Rachel, Leah. Oh, sorry, there's a message I've missed here. Are options such as birthing pools, etc., still available if that was our birthing plan? Would that be still possible, Sarah?
Currently, yes. If you're not symptomatic of coronavirus, currently, yes. Yeah.
I must say it's amazing that we're able that Leeds is able to support birthing plans under the current situation. Is that a common situation across all of the health trusts in the UK, Sarah?
I think we're all looking at the same guidance, but there are different interpretations of the guidance, and different things that different organisations need to take into account. We obviously have staff who are self-isolating or social distancing, and that changes on a daily basis. But we really do empathise with parents who are coming up to this most wonderful time of their lives, and we will do everything we can to support them with their choices within the guidance from our Royal Colleges.
Great. Okay, I'm going to come to you all with ask you for one last tip. But before that, Jennifer Stewart said, I'd like to add that we had our little boy last week at LGI, and staff were amazingly supportive to myself and my husband, who is currently sleeping, but I hoped he'd listen in. Leeds dad! He's a Leeds dad! He's a Leeds dad! Never mind. Never mind. I had so many of the anxieties discussed, and the midwives were amazingly supportive, especially throughout. I had to stay in alone, which was made so much easier by the brilliant staff. So
we do have, hands up, an absolutely fantastic team at Leeds. They are amazing. Yeah, they are fantastic.
So a final tip, if you're having a baby at this current time, what should you be aware of, or what should you do, or what should you keep in mind? I'll come back to you, Claire. What's your one tip?
So my biggest tip would be to know that these changes are in place and be mentally prepared for them before you get to the hospital, so that you're not disappointed if your partner's been sent away. To prepare as much as possible for the changes that have had to take place within the hospitals. That would be my biggest tip. So it's not a big mental shock when you're walking in.
Ron?
Well, I just wanted to add to the earlier question that you asked Mark about, when you get home, how do you be a dad? How do you start? And I just wanted to add 3 quick points. I'll just say them. Work on your relationships with your partner and your baby. Communicate with your partner and your baby. And the third one is support your partner and your baby.
What do you mean by support?
Relationship support is the practical support in terms of being available, in terms of, the communicate would be about listening to your partner, each other's needs. And actually the support would be acting on those in terms of whether it be the mundane tasks as changing nappies, bathing the baby, learning to cook the different meals, the weaning, the breastfeeding, all that sort of stuff. And the relationship aspect would be about the adjustments you would have to make with each other, because you're now it's not just 2 of you, it's 3 of you, 2 plus a little one, or even if it was a baby there before, you've got another one. So you've got to look at the sibling relationship developing, as well as your own personal relationships, developing. So that's kind of like my additional tips to what Mark and Sarah actually added in terms of what it means to, begin to be a father. There's an awful lot more to it, but I'll keep it as brief as that.
Mark?
Yeah, so like I said, it's a lot of resources out there now, a lot better than it was. If anyone knew the Dad's Pad, you can buy it online, that can help dads. I think going back to relationship, like I said, it's just engage with each other. And if you are, in hospital as we know, it's uncertain times at the moment. Just be patient with the health professionals as well, because they're doing the best that they can under these circumstances. So, but if you are struggling with your mental health, that's my work. Just make sure you engage. Talk to somebody, talk to your partner. So many people are going through the same sort of situation at the moment. So don't suffer in silence.
Okay, and Sarah, please.
Okay, so I think be kind to yourself, be kind to others, and in this coronavirus pandemic, don't forget all the other things we talked to you about with regard to pregnancy, and keep thinking about the baby's movements and report to us, how you're feeling about this situation that we're in currently, but how you're feeling about other things to do with your pregnancy. And as I said, don't forget about the baby's movements, and it's really important that you are continually engaging with your baby. You're talking to your baby. Tell your baby, how you're feeling, but engage with your baby and engage with us if you've got any concerns about your well-being or your baby's well-being.
That's great. Thanks. Very, very sound advice. We've had a message from Jamie License. Luke has messaged to say, if there's time for one last question, how does parking work when you have someone in labour? The last thing I'd want is to be struggling with the parking meter.
Well, that's another great thing about the coronavirus. Parking is free in Leeds and the Wi-Fi is free as well. So if there's one thing you don't need to worry about at the moment, it's the Wi-Fi and the parking. So the hospital car parks are free, the barriers are up, and
we've got a message from Jamie saying, hi all, my wife Claire. That's you Claire.
That's me. That's my wife.
My wife Claire, along with others, has been updating the Leeds MVP page as often as possible with as much info as possible. Hopefully it might help answer the odd question or two you may have about what's going on and what's happening at the moment. Many thanks to everyone for being part of tonight's broadcast. Sarah Bennett from Leeds Midwifery Service, Mark Williams from the Father's Mental Health Campaigner, Claire Licence, Leeds Maternity Voices, and Ron Batiste from Leeds Dads. Knowledge empowers, and even when we find out things about the virus which might be worrying, as we understand more, the less worried we will be. I'm Erroll Murray from Leeds Dads, and we hope to be back soon. Thanks very much. We've overrun, We've overrun a bit here.
Yeah. Nice to meet you all.
Thanks, Erroll.
Nice to meet you all.
Yeah.
Nice to meet you, Mark.
Yeah.
Okay.
Well done, Claire. Thank you.
Yeah, well done, guys.
Thank you, guys.
No problem.
Nice
Thank
to
you,
meet you.
guys. Take care.
you.
Bye-bye.
Take care.
Bye-bye.
Stay safe,
Bye.
everyone.
You all hold on one second.